I'm one of the officers for the PAs in Asian Health, and we're having a special guest tonight from Logan University. This is our first PA Studentology 101, from PA pre-PAs to PAC. We have Professor Applegate here, and also we have Professor Sumners from Logan University, and the floor is yours.
Thanks, Sehun. Hi, everybody. My name is Professor Andrea Applegate. I have been a PA now for about 16 years. I've done cardiology, internal medicine, critical care, CT surgery, and I've always moonlighted in ER and urgent care. I've been in PA education now. This will be my 8th year in PA education. So I was at Missouri State, which is where I met Sehun, and went to Logan University about a year and a half ago to help build the PA program here. And Courtney is one of my associates.
Hi, I'm Courtney Sumners. I'm a PA, work in the state of Missouri, and I graduated from Missouri State originally in 2015 with a degree in cell and molecular biology. And then I attended PA school there in 2016. Since graduating, I've worked in the ER, cardiac surgery, and a little general and trauma surgery. I am a mom with 3 young kids. My oldest turns 6 tomorrow, so super excited to be here and talk to you about becoming a PA.
Okay, so I'm going to start us off. I'm going to share my screen so you guys can see what we are looking at. This is our building here at Logan. We are on a historically chiropractic college campus, and it's now a university with health sciences. So we get a nice range for some interdisciplinary chances for education. So let's start off with, what do PAs do, right? So when I was in graduate school, initially, I did not know what a PA was. I didn't know they existed. I knew what a nurse practitioner was. So I just happened to walk past the PA department office one day and stopped in and said, hey, what is this PA thing? I always thought I wanted to go to medical school. And so PA at that time we're smaller. We've grown significantly, and our scope it's expanded along with that. But generally, PAs are going to be taking histories. We are very good at taking histories and doing physical exams on our patients. We can order and interpret diagnostic testing that includes labs and imaging and screeners and vaccinations, things like that. We diagnose disease, and we can treat that, right? So we work on developing plans for our patients that can be, up to 4 to 6 components of a plan, depending on the disease process. We prescribe medications, and depending on the state that you practice in, sometimes that can go all the way up to Schedule II narcotics. And then we can also specialize in all areas of medicine. I like to tell friends and family that PAs can do anything a physician can do within our scope. The only thing that in Missouri we are legally not allowed to do is perform abortions. But we can interpret EKGs, we can interpret radiology. We have a wide variety of things that we are able to do. In some states, they have optimal team practice and can do more autonomous practice, but it just really depends on what you want to do. The world's your oyster. So transition that into where PAs work. So we are found anywhere physicians are allowed. So we work in hospitals, we work in surgical suites, we can work at the VA, we are in clinics, obviously, especially rural clinics. We are often found in emergency rooms and urgent cares, and cover the scope of patients. We see everybody from newborns to geriatrics. We can specialize in any field of medicine. We do have a few specialties that you can earn advanced CAQs, so advanced qualifications in those areas, but you can practice in pediatrics, you can practice in orthopedic hand surgery, you can practice in nephrology, cardiology, anything that would interest you. So many surgical specialties and internal medicine specialties to choose from. And then we are an vital part of the healthcare team. So not only are we practicing in rural clinics, but we are practicing in multidisciplinary teams as well. You'll see PAs rounding with attendings and fellows and nurse practitioner students and pharmacy. It really takes a village to take care of people. So we're an integral part of that. And we provide so many patient encounters per year for that patient population. Now, applying to PA school is stressful. Know that ahead of time, right? There are so many factors that go into applying for PA school. Just take a breath, plan it out, and move forward step by step, right? So when you're applying to PA school, you may put in your application and not hear anything for quite a while. You may just get a notification, your application has been received. And that's the last thing you know for weeks to more than a month. In that time, PA schools are reviewing your application. They are scoring the information that you have given us, and we are looking at where you would rank for a chance for interview, right? And in that time frame, you're going to be questioning yourself. You're going to be worrying, but don't. You have put your best effort out there, and we are looking at everything that you have written, your personal statement. We are looking at your scores from your classes. We are looking at your leadership and your volunteerism and what makes you special. Why do you fit well in our cohort? Why do we want to interview you and give you a spot? And how are you going to make our cohort better, right? Because that's the amazing thing about PA school is that everybody lends a voice, right? Nobody's on the same playing field. You all come from different backgrounds and have different life experiences, and that makes our profession very rich, right? PA school applications take a lot of time. It can be hours that you are working on this, and that's from the get-go. That's collecting transcripts, that is getting signed in, that is entering all your information into an application or CASPA, depending on what your school is using. And it can be a full-time job to get that application, and you may be looking at 40 hours really by the time you're done, and that's okay. You do want to start early. Oftentimes this is, a year to 2 years of you working on your application process before you get into a school somewhere. A lot of that time is spent on doing your prerequisite coursework. If you need to retake a course to boost that grade or boost that GPA, you're going to need to factor that into your timeline, right? You're also going to be acquiring your shadowing hours. You're going to be acquiring your patient care hours. And really, it's a long-term investment in your future. You will want to take the time to write a good personal statement and find good letters of recommendation to ask your professors, a coach, somebody who really knows you. You want to make sure that they know what the requirements are, what you're really going for. I've read personal statements before that are generic, where somebody says, this person will be a great fit for medical school. And you're not applying to medical school, you are applying to PA school. So make sure that whoever is granting you that letter of recommendation knows what your plan is. Every school has the big things that they are looking for. So sometimes that is additional items that can come in as supplemental application components. Some of it is just a different statement, maybe about how a certain experience affected you, or a life experience and how that has affected you. So be aware of that. It's not always just one single application, top to bottom. When you are looking at interviewing, realize that you may be sent for a day interview. It may take 2 days for an interview. Different schools have different processes. So make sure that you are aware. time-wise, you may need to take off from school or take off from work to travel, or set that time aside for a virtual meeting, whatever that school is using. What else? The big component financially is not just taking your time off, but also the cost of application into CASPA or into private application processes. So it just depends on the school that you are applying to and where they are in their use of a centralized application service. It takes effort. And it takes budgeting. So make sure that you are factoring in initial application fee, additional program fees, transcript fees if your school requires you to pay for official transcripts. If you're taking the GRE or the MCAT or the PA-CAT, those tests have a financial cost to them as well. Taking time off of work or school to go shadow can affect your financial bottom line as well. And then any travel expenses. So are you flying? Are you driving somewhere? Do you need hotels, meals? Make sure that you're factoring that into the cost of your application cycle. I would say that most PA students are going to spend hundreds to thousands of dollars to apply to PA school. So again, just with the time component, it's a financial investment in your future as well. So when you are looking at getting everything together to apply to PA school, it is stressful. I would say things to help mitigate and manage your stress include preparing early. Set aside a file folder or an area that you are going to keep all of your documents, all of your applications, where you are in the process of your applications with the schools that most interest you. Secondly, I would say be selective in where you want to go. Every program has to publish its mission statement and its goals. So read through those. What school aligns with what you want out of your career, right? Don't waste your time or your money in applying to places that you don't want to go. If you don't want to go live in St. Louis, Missouri, which is where I am, which I highly recommend. It's a great city. If you don't want to go to the Midwest, then don't apply to schools in the Midwest. If you don't want to go to Montana or the East Coast, don't apply to those areas. It's a waste of your time and your money because many of those are going to have supplemental fees that you're going to have to pay. I would say create a budget and a timeline. So if you know about when you're going to finish your undergrad and when you want to get into a graduate program, start counting backwards for how soon you need to start applying. When do you need to start requesting transcripts? When do you need to have prerequisite work completed? If it wasn't in your general bachelor's degree, when do you want to have those wrapped up? Different schools have different requirements. Some say you can finish prereqs in December. As long as you pass, you can start school in January. And some schools say, no, you need to have those wrapped up by summer so we can get grades and transcripts before you would start in January. And just know what that school's requirements are. Again, most of that stuff is posted on their website. It is required by our accrediting body, ARC-PA, that those things are posted. Seeking mentorship is really important. Most of you wouldn't be on here if you didn't have an idea you wanted to be a PA. But talking to PAs who are out in practice, talking to your advisors in your programs or advisors in groups and caucuses such as this is a great idea. Talking to current PA students, if you have access to a local school and they have a pre-health society or pre-PA society, contact them. A lot of state organizations also have pre-PA memberships that you can be involved in to get connected and start networking in that area for people who are out in the profession currently. And then finally, I would say that really working to promote personal wellness. It is a push in our career, in healthcare in general, that PAs, physicians, nurse practitioners, nurses, everybody runs themselves into the ground, and we all experience a higher rate of burnout than a lot of other professions. So start now, learn how to maintain healthy routines, prioritizing your physical health, your mental health, and really working on learning how to sleep well and function well when you are under times of stress. PA school is hard. Applying to PA school is hard. So it's not about being perfect. It's not about having a 4.0 and sailing through all of the testing. It's about being a person who is professional, who has some grit, some resilience. Having life experience is not a bad thing. I want to hear that you've maybe struggled with something in your life and you've overcome that struggle, and how did you do that, right? Speaking of seeing those things on an application, what am I looking for when I'm saying that, this person has a strong application, is readiness, right? I don't need perfection. I need somebody who has set their timeline up, who has created a good social support system for whatever they're going to do in PA school. Their family understands that this is going to take them out of activities and major vacations and things like that for the next 2 to 2.5 years while they're getting this education, and having that understanding and that support from your friends and family is really important. I would say if you feel like you have any shortcomings in your application, address it. We would much rather you have the awareness that, hey, I really struggled as a freshman, and these classes I know don't look great, but my overall, I finally got it together sophomore year, and this is the progress I've made. Because we're going to see that. We're going to see, hey, they got all B's and a C and this and that, and we know that people struggle in that transition from high school into college, or coming from a rural high school into a more urban setting. And it takes some adjustment, it takes some time, but address those ahead of time, instead of us having to seek that out for you when you come in for your interview. A strong academic foundation is important. We do look at GPA. It is a very strong predictor for how people are going to do in the program. And ultimately, studies have shown that it's a strong predictor for how people perform on their boards. So we do look at GPA. Now, minimum GPA is typically 3.0 in a program. We are going to look at giving preference for those who have higher GPAs, but that doesn't mean it's the only thing that is important in your application. We do look at upward trends, like I mentioned, earlier. So if you struggled at the beginning, but you've been doing much better in your upper level science courses, that speaks to how you're going to do with the rigor of a PA program. And then we want to see that you have a very solid foundation in your prerequisites, right? So we want to see full courses of anatomy and physiology with lab, because those are the harder courses that students struggle with when they get into a PA program. So taking a summer shortened version of anatomy with, a brief lab is probably not going to give you the base foundation you need to really succeed well in graduate level anatomy or graduate level physiology. When we talk about patient care experience and having that high quality experience, really we're looking for the depth of your patient care experience. Did you spend a minimum number of hours in a basically patient adjacent role, or were you, did you spend 500 hours as a patient care tech, where you were hands-on with multiple patients for 12-hour shifts? That's going to give a very different perspective than something like a patient transporter, right? Because you are managing that patient's needs over a much longer time. So depth of your experience, not just the hours can play a part. And I would say that really being able to reflect on your healthcare experience comes in as well. I've had great stories and great experience coming from students who were scribes, and you wouldn't think that because scribes are just there, typing on the computer. But the things that they have been exposed to, and the conversations that they have seen that physicians have with their patients, or other PAs in the department have with their patients, really give them a appreciation of healthcare and the team approach that you might see in an ER. Professional experiences. So in your application, you're not just going to be looking at experiences with patient care, but what else have you done, right? So have you had leadership of any kind? Have you been on a board? Did you serve in, a capacity for your fraternity? Were you in, did you participate in collegiate sports? All that's going to speak to your maturity, your reliability, your ability to multitask and manage a level of stress that maybe another applicant didn't. So speak to those things. If you came here and, you had to move states, you've experienced frequent moving because of military service with your parents, if English is your second language, and how did that affect who you are as a person and your involvement in healthcare? And then I would say that understanding the PA role and really how we function now in medicine. It has changed a lot over time. We are no longer the physician's assistant, right? A lot of PAs practice very autonomously, and know what that is. This is not a backup to medical school. We talk to students now in middle school who want to be PAs. We've had second generation PAs now. I've had 2 students whose parents were PAs go through PA school, and it's so amazing to see that progress over time. I would, again, thinking back to the student whose application, all of her letters of reference were regarding medical school. We want to see that people are driven to be a PA. If you want to go to med school, go to med school. That's a great option. If you want to be a PA, be a PA. I always said that if I didn't like being a PA, that was an option. I would go to med school. Obviously, that's not happened. I love our profession. I love advocating for it, and I love what we can do for patients. So when you are looking at applying to schools, like I said earlier, there are more than 300 PA schools in the United States, and there are developing programs like ours that are really working to expand PA profession. And so every one of them has different missions, different values, different goals, different structure. Some start in the fall, some start in January, some are 27 months, some are 24 months. So figure out what works well for you. When you're looking at their mission and their values, do they have primary care focus? Is everybody a generalist, or are they heavily training you to be surgical? Are they heavily training you to be ER? Do they have a focus on giving back to the community? Do they have a focus on faith-based learning? Do they have a focus on rural healthcare or urban healthcare? So find a program that matches with your interests. When you're looking at program structure, do you want a module-based program? Do you want a layered program? Do you want a program that's primarily passive learning or more active learning? I will say that education as a whole, especially graduate education, is moving more towards that active model where you're doing kind of flipped classroom. You do a lot of prep or reading beforehand, then you come to class and you practice that. And you are, doing EKGs in class. You are talking about how this physical exam finding is important in class, rather than sitting there for 4 hours listening to somebody tell you about how to do a physical exam. Um, Other things that you may want to consider are what type of anatomy do they teach? Is it a cadaver anatomy? Is it a blended anatomy? Are they using anatomage tables? Are they using VR anatomy? Do you get clinical exposure in your first year? Are I know at Missouri State, we always did a 2-week clinical practicum where you took 2 weeks off, you went into practice, and then you came back refreshed of not having to sit in lectures for 2 weeks. But also seeing, this is what I'm going to be doing for the rest of my career. The other thing is looking at what type of integration, what type of interpersonal education does the program offer? Are you working with nursing students and residents and fellows and pharmacy students? And what other programs do they offer in that institution? And that can give you a key to what that institution's focus is going to be. Finally, I would say if you're looking at clinical training, different programs utilize different models when they're placing students. Some programs are going to use a lot of hub sites where you're sent to an area, you stay in that area, and you do multi-rotations in that region, whether that's another state or another city. Some are going to be tied to medical institutions. So you may be going to that university hospital for a lot of your rotations. Some of them are not affiliated with any health systems. And so you're going to be experiencing a wide variety of health systems, which may mean a wide variety of EMRs or learning how to do things within those different areas. I always tell students that the first 2 days of any rotation are learning, like, where's the restroom? Where's the cafeteria? How do I get food? Where can I do my charting? You're just learning that, and it's different everywhere you go. For culture, like I said, there's a push in our profession to really be aware of student wellness and provider wellness. So see what the institution offers for you when you are looking at your choice school. The other thing to look for, things like academic support, social support, groups, what resources in that area do you have to get integrated into a community? Our ARC-PA now requires that programs identify some type of a remedial process for students. So what type of remedial learning, what support learning do they offer? How does the program identify struggling students, and how are they going to support you if you start to have trouble with an area? Another culture component, I would say, is your faculty. You want a faculty that works together. You want faculty that are approachable, that are present. Do they come in and they teach and then they leave and you can't track them down? Are they in the office, for regular office hours? Is it easy to email them or send them a message and get a reply back within, hours or at least a day? Most, and then finally, I would say, when it's time for you to ask questions in your interview, these are things that are great for you to reflect back to the faculty. Ask about their program, right? We all love to gush about things that we find adorable, and we all love our programs. So when you're like, so why do you teach here? What is something that students say that they love about this program? Or how do you, really work to support students? So those kind of questions are great to turn around, because not only are you getting your question answered, but you really want to dig into the program that you feel is going to be best for you. Some common things that we see with applications are simple mistakes. And that can be grammar mistakes, that can be not filling out sections of your application, that can delay getting an invitation. Not having your minimum requirements before you apply, whether that's your credit hours, your classes, volunteerism. Some programs require you to take standardized testing. So have those in place before you apply. And be aware of deadlines as well. Make sure that you're meeting those minimum requirements in a timely fashion. I would say poorly written personal statements are definitely a flag. We can tell when AI has been utilized to write a personal statement. I will say that everybody wants to help people. Everybody has some story of some healthcare provider that was instrumental in driving them to become a PA. So we hear those all the time, but really, what makes you you? I want to know what your strengths are, what drives you. I don't want a generic letter of healthcare is great, being a PA is great. Like, let us see who you are in your personal statement. I don't need to see who ChatGPT is. We already talked about letters of recommendation, so you guys understand that. Inconsistent explanation of your motivation. So, why just have the same message throughout, when you're looking at your personal statement and then in your interview, and in the experience that you've had and what's driven you in your volunteerism, just kind of have a consistent message that helps us see what your intentions are with PA school. Late submissions, again, it's a professionalism thing. You're becoming a professional starts at application. And then the poor understanding of the PA role. So we are PAs. And we are physician. In 2021, the AAPA at our House of Delegates meeting, we voted to become physician associates. There are people who don't know that, and that's okay. Initially, the term physician's assistant with an apostrophe S was coined in the 1960s. And the first program that Eugene Stead created at Duke was the physician's assistant program. We briefly switched to physician associate in the early 1970s, and with pressure from the AMA, who created our profession, we switched back to physician's assistant, and then we dropped the apostrophe S in the early 1980s, and we've never used the apostrophe S since then. So in your personal statement, in your writing, make sure that you're not using the apostrophe S possessive. That's a red flag. Okay, I've talked a lot. So let's move a little bit quicker. Ways to stand out with your application. I would say that being concise is important. I don't need a 3-page dissertation. I just need to see who you are. So say what you need to say it well, say it professionally, so we can get the gist, and move on, and be real. Right? If you've struggled, talk about your struggles. That's totally okay. We want to see real people. I don't need to see perfection. If you're going to talk about an experience, do a little bit of reflection about that experience. Don't just say, I went on a mission trip to such and such. It was great. We helped people. Talk about maybe a patient that you saw that really spoke out, really spoke to you, or a procedure that you got to help with that really, kind of drove your interest in becoming a PA. And then just be professional and respectful. I would say that coming across as callous or coming across as aloof is definitely an off-putting thing for faculty interviewers. Again, through all of this, what is my goal? My goal is to train PAs. Why do I train PAs? Because I want good colleagues. I want good people who are going to work with me, who are going to take care of my family. So if I'm looking at you, my question in the back of my head is, would I trust this person to take care of my grandma? So this is a job interview from day one, and it's a job interview to join our profession. It's not just get in a program, get your boards, and off you go. We want you to be great PAs and extend the profession. PA school is tough. It is a full-time job. It is manageable, but it is a full-time job, and treat it like that. Plan to be in class Monday through Friday, 8 to 5. You're going to have studying in the evenings and studying on the weekends. You don't have a lot of free time, but it's not about being perfect. You're not going to have time to read every chapter and analyze it and take notes on everything and reread your notes and re-listen to lectures and rewatch this video. It's drinking from a fire hose. Just be as efficient as you can, learn as much as you can the first time, because you will forget it and you'll learn it again, and you will forget it and you will learn it again. And that's okay. That's expected in this high intensity education process. I will say I did cry the first time I got a C on an exam, because we all try to be perfectionists, and that won't happen in PA school. You will struggle with a topic, you will struggle with a section, you'll struggle with a unit, and that's okay. We are humans. You learn and you move on. Focus on learning and setting up your framework, and relearning over and over and over again. You have an entire clinical year to continue learning. You don't have to learn it all in didactic. Having a strong social support is ideal, right? So have your classmates. They are going to become your family. You're with them 40 hours a week plus. So they are going to be your family. Your own family is not going to see you much, and that's expected. When you have the time to spend with them, take that time, right? So take your evenings if you have little ones, or a significant other or friends. Make sure you're taking your brain breaks. You're getting outside in the sun. You are taking walks. You are doing the things to keep yourself healthy. And when you feel like you're struggling, ask for help early. Again, we all have remediation processes. We all have support systems set up for you. So make sure that you're identifying that early. If you need an extension on something, get in touch with us early. I don't care if your assignments are late, as long as you let me know ahead of time, and it's not continual and you're 6 assignments behind, right? Life happens. Life doesn't stop because you're in PA school, right? We all have parents and grandparents that can get sick. We have little ones that can get sick. Just lean on your supports, which is why social supports are so important. We've talked about well-being. I would say that the big 3 that people forget in PA school are sleep, eating well, good nutrition, and exercise. Your brain needs those to process what you are learning. If you aren't sleeping, you will not develop long-term memories, and you will not be as efficient of a student as you hope. Set boundaries with your friends and your family and yourself, right? You cannot study all the time. You have to cut off at a certain time. Your family needs to understand that you are going, this is not like undergrad where you only had class Monday, Wednesday, Friday, and Tuesday, Thursday afternoons. This is an all-day investment, and treated as such. Do not lose connection with your pre-PA life. That's very important. Again, those friends and family that you had before PA school will be there when you're out of PA school, and you no longer have your PA colleagues every day. So make sure that you are keeping in touch. Don't fall off the face of the earth. And just come up for air occasionally and say hi, and go, have drinks and dinner with them when you can. I will say that you are not your grades. You are not your scores. You are becoming a PA, and it takes time and it takes effort. You can ask Say Hoon. I say this all the time. You just have to get through. You just have to get through. You just do it and move on. You just have to get through. Once you're through, you're a PA, and nobody will ever ask you about what score you got on your cardiology exam. I promise. All right. And then finally, after you graduate, you're going to continue to learn, right? PA school is 2 years, 2.5 years. I always tell people you have another 2 years of on-the-job training before you really feel like your feet are underneath you. You know what tests to order, you know how to interpret those tests, you know who to go to get this person on a schedule, or to get this person referred here, or how to get somebody a sleep study, which can sometimes be very frustrating. You're not going to know it all. You need to know how to be an entry-level PA. That's what PA school sets you up for. You are not going to be the people you were mentoring. That takes years and years and years. So when you are graduating, and you're getting your first job, look for jobs that have good mentorship or good onboarding systems in place, have good teams to help support you. And if not, if you are forging ahead and this is a new PA rule and nobody has ever had a PA at this clinic before, reach out to your state and your constituent organizations, because we have resources that can help you. All right. You're going to want to know what kind of training period do you have? Are you getting 30-minute appointments for the first 3 months, and then they're going to back you down to 15-minute appointments? Are you expected to see 20 patients a day, or you expect to see 10 patients a day? What is your metric? What are they performance-based? Are they RVU-based? Are they time-based? Are you seeing patients on your own after a certain period of time? Are you going to be working in tandem with your collaborating provider for an extended period of time? Ask about team environments. You want to know, how long has the team been here? How long has the shortest person been hired? Do they have a high rate of turnover? If everybody's been there 6 months, that's concerning, right? Why do they not have long-term employees? Or if everybody's been there for 10 years and you're the addition, that's a much more stable environment to get into. Just like you set boundaries in PA school, set boundaries with your first job as well. You want to develop good habits. Go home. Don't take your charting home if you can help it. Make sure that you are maintaining those relationships and time outside of your clinical practice as well. And remember why you did this. At the end of the day, when it's a rough day and, you had to code somebody for 20 minutes and they didn't make it and everybody was sick and you're tubing everybody and it's just a miserable day. Why did you do this? Why did you put yourself through the misery of PA school to become a provider to help people, right? Take time. I promise you, I come back to this. First week of school, write out a paragraph of why you want to be a PA. Tape it to your fridge. And when it's a bad day, read that. Why did I want to do this? Why did I want to put myself through this to get into this profession and help people? All right. Most of this, I think I've already talked about. So find the thing that brings you joy. So you obviously are not getting into this because you don't like to learn. So lifelong learning is important. Find the thing that you want to fight for. So even if it's, outside of clinical practice, do you want to advocate for the profession? Do you want to volunteer for an organization? Do you want to help at the, local health department? You can find something outside that can give you that joy if it's, if not your clinical practice. Advocating for yourself is important, and that can be within like an advanced practice council, being a team lead for your group, or even joining national and state societies, right? I'm a member of the Missouri Academy of PAs. I sit on the board as the treasurer and the CME chair. I am an elected member of the House of Delegates for AAPA, so our national organization. So I go to the essentially our PA Congress every year and work with them on what things the profession wants to move towards. So that's things like we've passed optimal team practice in the past and our name change. And lately it's been the doctorate as a terminal degree. That's come up the last few years. And we've had some really good debates on the floor about how that would change our profession. And then finally, I would say give back to your profession. That's very important. If that's coming into guest lecture for your program, or taking a student, or taking a shadow, or speaking at a local, pre-PA group or pre-health group of what a PA is and why we are vital to healthcare. Because again, there are people out there who don't even know what PAs are. So spread the word. I think all of this is pretty self-explanatory. Find something that really speaks to who you are. Go to a school that supports those values, and be the best clinician, the best partner, the best associate that you can be for your patients and your other healthcare workers. Being a PA is definitely a marathon. It takes time. It takes a lot of effort, but it is so rewarding. I've been brought to tears by patients. I have laughed. I have enjoyed watching patients grow up. I've enjoyed watching patients grow old. It really is a great profession to get involved in. Yeah. So I'm going to turn over to Courtney to talk about our university and kind of where we are with our program. Do you want me to stop sharing, Courtney?
If you don't mind, you can keep sharing because I don't have mine
Okay.
pulled up right now. I'll just
Yeah, that's fine.
Perfect. Thank you. So I'll pivot and talk a little bit about Logan. Logan University is a health sciences institution. We're located in Chesterfield, Missouri, which is about 20 minutes outside of St. Louis City proper. It's a nice suburb, lots of green area. Definitely looks a lot less like the city. And we were traditionally a chiropractic college, but we've now transitioned to offering multiple master's level programs and bachelor health science programs. So we've got like master's level dietetics and nutrition degrees, and now our newest program is PA. Thank you. So a little data dive on Logan. We've got about 1,500 students, so it's a small, tight-knit community. We've got 11 academic degrees total. We're about 50-50 male and female students, and we have a huge base of international students that come to Logan for chiropractic. Not a lot of countries outside of the United States have chiropractic institutions, so we get a lot of international students, which is really great. And our average age is around 29 years old. What is going to set Logan PA program apart is that we are an accelerated program. We're going to have a 24-month program with a January start date. That will be 1 year in didactic and 1 year of clinical learning. We have experienced faculty with multi-level organizational involvement, and that's really exciting for us because we have faculty members that are involved in all of the large PA national organizations, NCCPA, AAPA, our state organization, PAEA, and even ARC-PA. So that keeps us really up to date with everything that's going on in the PA profession. We have a beautiful campus, as I said. It's nice and green and open. We have lots of newly constructed facilities for learning, including a brand new anatomy lab. And we really have a commitment to supporting our students. We want to have close relationships, small mentoring groups with our faculty and our students in our PA program. And that's all to create like an open, inviting culture. We recognize the importance of diversity in learning styles and in upbringing, and we want to do our best to support each and every one of them and embrace differences among our students. And lastly, we're going to have a sequenced curriculum, and I'll talk a little bit about that, more about that in a few slides. But basically, we're going to have several courses that progress together through body systems, which is different than some programs teach, but we just think it will be good and kind of follow a nice staged and logical approach for our students. Talk to you a little bit about the team now. So this is our team. We have, like I said, really experienced faculty, and we're lucky being a new program that we have together more than 45 years of experience in PA education and more than 120 years of clinical practice experience. Our team has been a part of a variety of other programs, and they're all really unique. So some of them have problem-based learning, and some of them are more that traditional module-based learning. And we've kind of taken bits and pieces of all of those programs and tried to come up with the best one for us and what we think will serve our students best. Like I discussed, we have organizational involvement on all those levels, and really heavy involvement in our state organization, which is important for really protecting and moving forward our PA profession, especially locally. So Dr. Brooke Miller is our founding program director and program chair. Jeremy Boyce is our admissions coordinator. And if you talk to any of the admissions, if you email the admissions email that's listed on our website, you will talk to Jeremy, and he's amazing, really knowledgeable about the program and so helpful. So he's a great person to contact. Cheryl Mestis is our administrative assistant and helps us out in the office. That next one is me. And like I said, I am a principal faculty member along with Andrea, Stephanie Breyer, Amy Mossman, and Megan Glover. And Dr. Jason Goodman is our Director of Assessment and Community Engagement, and he is actually a chiropractor by trade. So it's been great to have him on our team, and he knows everything about Logan and has been at Logan for a very long time. Rebecca Lovelace is our Director of Didactic Education, and she also sits on the board of the AAPA. And finally, Dr. Goddard is our medical director, and he's a primary care physician by trade and has been involved in PA and medical education for many, many years. So we're really lucky to have a wonderful team and feel that it has really given our program an edge. I'll talk about the facilities a little bit. I mentioned earlier we have a brand new anatomy lab. It's really open, lots of windows. There's a fancy air purifying system that reduces the formaldehyde smell, which is underrated in my opinion. It's really, really beautiful. And we've also got comfortable and spacious lecture rooms. We've got a beautiful lecture room attached to that anatomy lab and also several others. We're in the process right now of building kind of like a simulation center with multiple patient rooms where there's like a two-way mirror so your instructors can observe your patient encounters. And another thing that's unique about Logan is that they bring in standardized patients, which are like paid actors for you to do clinical scenarios with. And not a lot of PA programs have access to those. So that is a really, really fun thing that Logan does. Tell you a little bit about our campus next. We've got a beautiful open and green campus. There's a picture of it on the top there. We've got 112 acres, and some of that is wooded. There are lots of creatures that are all over campus all the time. Lots of deer. The other day I saw 2 turkey that were just hanging around in the parking lot, so that's always fun. We've got an 18-hole disc golf course, an on-campus gym, outdoor recreation and athletic fields like sand volleyball and a baseball field, pickleball courts. There are lakes, playgrounds, walking paths, pavilions that you can rent out. We've also got a community chiropractic clinic, and that is free to students and their family members to go and get chiropractic adjustments. It is really awesome. I had actually never been to a chiropractor before I started working here. Highly recommend. I've been so impressed by the students that treat you there, and it's really giving back to the chiropractic students as well because they're in the end parts of their schooling and they are learning to take care of patients. So it's all really fun. And of course, parking is always free on our campus. So now I want to talk to you about student support. And like I said before, that's something that we really care about. And we want to make sure that we set up our students for success. So as far as social support and mental health support, there's going to be on-campus and virtual support available 24/7 for our students. When it comes to academic support, we plan to have a 1-to-5 student to mentor ratio for each cohort. And that means that each faculty member will have 5 students that they meet with, hopefully on a weekly basis at first, and then as much as is needed by each student after that. And that's really to create a personal relationship with the faculty member and those students. We want to know them on a personal level. We want to understand their individual learning style and how to best support them, because no 2 students are going to be the exact same in those things. Again, we want to focus on creating that open and inviting culture. We want to be able to identify students that are struggling early and then help them get back on track quickly. Apart from our faculty mentors, our students will always have access to campus resources, and that's like our writing center and our testing center for students that need accommodations. The writing center is going to be great for students when they're doing their research project and may need some extra pointers on how to write that up. We'll switch over to curriculum now. Some things I want to highlight about our curriculum are that we do have access to some advanced technology, like the anatomage tables. They can do some really, really cool things. You can actually have an EKG pulled up and then watch what the heart is actually doing in real time. That's just one example of like many cool things that you can do, but you can do kind of like a mock dissection with the anatomage tables, and it's just a great way for students to study. You'll always have access to those. There's one in the library, and that's open 24/7 for students. Our courses, like I mentioned, are sequenced by body system, and that's going to provide increased retention and understanding, because when you're learning about the lungs and anatomy, you're also going to be learning about how to assess the lungs in our patient assessment course. You're also going to be learning about CT of the chest and how you look at lungs on imaging. You're going to be learning about any pharmacologic treatments for the lungs, and you're going to be talking about pulmonary cases in our clinical reasoning course. So all of it is staged together and kind of sequenced in a way that makes sense. And we think that's going to make things easier for students rather than bouncing back and forth between different topics in different courses. And we can go to the next one and I'll show you our little curriculum schematic. So this is just a schematic that shows the names of our courses, and I won't bore you too much with the details of these, but we've got a trimester system at Logan. During the first 3 trimesters, it's going to be the didactic education. You're going to have a PA professional studies course that kind of takes you through the history of the PA profession, different things that you need to know. We'll talk about medical ethics, medical errors, and that sort of thing. Diagnostic medicine is where you learn about imaging and labs and procedures. We've got patient assessment for the physical exam, fundamentals of clinical practice, goes through different kind of medical specialties and the nuances with each of them. So pediatrics, family medicine, geriatrics. Then pharmacology, we've got a clinically oriented anatomy and medical sciences. So that's going to be your anatomy and physiology course, and you're doing that over 3 trimesters. Some programs will front load anatomy and physiology, but we are going to carry it through sequence with our other courses, as I discussed earlier. Clinical reasoning is kind of your problem-based learning course where you talk through different cases. And then pathophysiology and clinical medicine is really that bread and butter medicine course where you're learning about disease processes and everything specific to each of those. Then trimesters 4, 5, and 6 will be the clinical year. We'll have a PA graduate seminar, which is where your research project will take place, and you will have different lectures about things like building a resume and interview tips and things for like the professional practice of a PA. And then we will have your elective or your clinical rotations, which includes 2 electives, and then our required rotations, which are in behavioral health, family med, women's health, emergency medicine, internal medicine, pediatrics, and surgery. So our PA admission requirements are similar to most programs in that we require a bachelor's degree, an overall cumulative GPA of at least 3.0. We also want a 3.0 GPA in prerequisite courses, and a complete list of those can be found on our website, but they include some of those courses that Professor Applegate mentioned earlier, like anatomy, general chemistry, organic chemistry, medical terminology. We want 500 hours of direct patient care experience and 3 letters of recommendation. And we do ask that the letters of recommendation, at least one of them comes from an academic source and one of them is from a source that can speak more clinically, like somebody that supervised you in your clinical role. On the next page, we got important dates. So our applications for our January 2027 start actually opened at the beginning of February. They are on our website. And the application itself is close to the format of CASPA, so it shouldn't be too difficult to fill out if you filled out a CASPA application before. But they come directly to our website. And if you have any questions about that, I will have a link to that here in a couple of slides, as well as an email address that we are very quick to respond to if you've got any questions regarding that. Our applications will stay open until September 1st. We do offer something very cool and exciting called PA campus visits, and that's when prospective PA students can come to our campus. You get a campus tour, you get to meet the program faculty, we do a little Q&A, we have lunch together, and it is so fun. We just had one the other day, and we took students up to our beautiful anatomy lab, and you actually get to like see some of the cadavers that the chiropractic students are working with, and the anatomy lab assistant is amazing. She brings out like all these brains and hearts to show the prospective students, and it's just so much fun. So we would love to have you, even if you're coming from from a distance, we can help with travel arrangements. We would love to have anybody come visit. Interviews are going to take place over the summer, and then we will make selections for a January 2027 cohort in the fall. So finally, just to wrap up and remind you how to set yourself apart as an applicant to our program or to any is to highlight your diverse life experiences, anything that makes you stand out. Make sure to volunteer within your community, shadow some PAs, and maybe in more than one setting, to show that you are truly interested and you have a good understanding. Make sure that your GPA is competitive. If you need to retake a course or two, go ahead and do it. It might put you in a better standing. Get involved in your PA organizations. Your state and national organizations often have like a prospective student rate that's a little cheaper, and it goes a long way to support the profession. Again, you want a well-written personal statement that addresses any concerns in your application. You want to make sure you're selecting high-quality references and that you know what a PA does. Can't say that enough. And I will leave you guys with a few QR codes on the last page here. One is where you will go to register for a PA visit day. One is to follow us on Instagram. We would appreciate that as well. We are constantly posting tips for applying to programs and things that will be helpful for any student. And then the third one is just our PA website, which has all kinds of information about our admissions process, our tuition and fees, basically anything you could want to know about our program. And anything else, please email us at pa-admissions@logan.edu. That will come straight to Jeremy, and he will contact me if needed. I am the chair of admissions too, which I don't think I said earlier. So really excited and really thankful for your time today and your participation. If you have any questions, I know Andrea and I would be happy to answer any, and we are really honored to speak to you on behalf of Logan University.
Wow, lots of info. Thank you so much for your time. It was so much fun just listening to. It brings me the memories of all the things I prepared, and then all the way till now. It's just like just walking down memory lane. That was great. We'd love to have some questions from our attendees. So if you
Yeah.
want to leave any comments on the chatting box, and we'll go from there. But I do have one question. In a perfect world, let's say I apply this year, but then I never got in. I couldn't get in to any school. For those folks who are kind of afraid of going through that process, what do you recommend? What is your suggestion for those folks that just couldn't get in the first time?
Don't give up. Usually it takes multiple application cycles for students to get in. The best thing that you can do is contact your admissions chair or your admissions staff and ask how to improve your application for the next time, right? That maybe you need to retake a class. That may mean you need to get some more depth in your patient care hours or type. It may be that you are very green, right? You have done nothing but school from high school to undergrad to now trying to get into grad school, and you just don't have a lot of life experience. So, maybe to do more volunteerism or serve in some capacity. So the best thing you can do is not give up, because it takes time. Even some absolutely excellent applicants that I have seen come through don't make it through the first time. They just don't fit that cohort. And the next cohort that comes around, they are an excellent fit and they make it and they move on, and become fantastic colleagues to work with. So just because you don't get in the first time, like I said, this is not a perfectionist process. It is very competitive. I would say that, so for instance, at Missouri State, we had 34 seats and we would get 700 plus applications. So if that tells you anything about how hard it is to make those decisions to fill those few seats, sometimes it takes finding the right program for you that you are a fit for. Because and that's the other thing, once you get in, you deserve to be there. You were smart enough to get in. Don't feel like the first time you struggle that, oh, that's it, I can't do this. I had horrible imposter syndrome going through. I'm first gen college, and first time I failed, I was like, oh no, I've made a horrible mistake. You didn't. It was just a topic that you didn't learn the first time. It's okay. What other
Thank you
questions?
so much for the answer. Yeah, I think we have a question from
Mackenzie?
Mackenzie Sinclair.
Yeah.
Go ahead.
Hi, how are you all doing this evening? I just want to start off by saying thank you so much for that wonderful and in-depth presentation, and I'm happy to be here. I am a pre-PA student that is currently in the post-bac process and deciding whether or not I should apply this cycle or waiting another cycle. So a little bit about me, I graduated with my Bachelor's of Science in Nutrition from the University of Houston back in May of 2024. I had had difficulty my freshman, sophomore year with transitioning from another school, COVID, personal issues. So my GPA from freshman and sophomore year are not too high. However, I do show an upward trend in my junior and senior years, as well as the last 2.5 years post-bac, including retaking courses for A's and B's or taking upper level and rigorous science courses and prerequisites to get A's and B's. So my question to you would be, if a school has a cutoff for 3.0 for science or cumulative GPA or prerequisites, if you take a bunch of courses to mitigate and get right above that 3.0 line and the rest of your application is very competitive, realistically, do you have a decent chance or shot of getting into that program if the rest of your application is stellar? Or is it better to focus on programs that don't usually require as rigorous GPA?
We were actually just talking about this the other day, about, if your prerequisite GPA was right there, that 3.0, but your overall is much higher because of that work elsewhere. We do take into account how many upper level sciences people have taken, and you do earn more credit towards your application score for taking higher level sciences and taking multiple higher level sciences. So that can help balance somewhat. And retaking, if you have to retake a prerequisite, we see that, but we also see that you put in the effort to retake that prerequisite and get a better score in like OChem or Gen Chem or whatever that may be.
Yeah, I agree. And I think that, again, this is a situation where you want to use the time in your personal statement or in your interview, if you are offered it, to really explain why you explained it to us. And I think you're not alone. A lot of students that came up and were early in their college career when COVID happened and they transitioned to online learning, a lot of people struggled. So you're not alone. And I think it goes a long way to kind of just explain where you were at and be honest about it. And most admissions staff or faculty reviewers are going to respect that and see that you have some grit to you.
Thank you both so much. I appreciate your insight.
I will say that I had a rough time in COVID, and I was just trying to teach and figure out how to do this online. So, I mean, we understand the difficulty that people faced. We had, graduates who were trying to get jobs during that time. We had clinical students, didactic students who were all trying to struggle. So, just address that and be open about it, because we all lived through it and know the struggle.
Yes, ma'am. Thank you for that. Absolutely.
All right. We have next up Cindy for a question. Go ahead.
Hi, can you hear me okay?
Yep.
Hi, I'm Cindy. Thank you for the presentation. I noticed that some programs look at specifically science GPAs and some don't. For those programs that don't, do they just solely focus on the cumulative and just some programs say last couple hours, like 60 to 90 hours, and just don't look at the specific science GPA?
Yeah. So I've been at Missouri State when we did and when we didn't. Programs are going to look at cumulative and then science, prereq, last 30, last 60, last 90. Like, they can set their parameters within CASPA to whatever they want them to be. And that's just a programmatic decision. What they feel like they get the best bang for their buck, and the best applicant pool and the best interview pool. Just look at the different programs requirements. I can't say that there's a great reason why some programs choose one over the other. It's just whatever they feel is going to give them the best, again, the best metric for their applicant pool.
Yeah, I will say I was researching this when I was trying to come up with Logan's admission scoring system, and there is no evidence that any of those metrics can accurately predict how someone's going to do on boards. So it really is just whoever came up with the scoring, their preference most likely, and what they think is important. But there is nothing that is better at predicting than one or the other.
Sounds good. Thank you.
Thank you. And any other questions or questions? Okay, well, if not, then we'll go ahead and close our session. Thank you all for being here, and we hope you have a great night. And good luck with your PA journey. Thank you all.
Thank you.
Thank you
Thank
so
you.
much. Have a good evening.
You
You
too.
too.
Bye. All right.